Too often we take the simple things for granted, like being able to eat and swallow or read and write.
Jane Lieberman heads the UCF Department of Communication Sciences and Disorders to help those with speech, language, and hearing disorders. Thank you so much for joining us today, Jane.
Thank you.
Let's talk a little bit about the NIH, and recently they've declared issues with reading disabilities as the nation's #1 health problem. What are your feelings on that?
Well, I agree with them, and I think there are probably two reasons why they have tagged reading disabilities as the nation's #1 health problem. First, we have a large segment of our population that's having difficulty with reading. Approximately 60% of children are having difficulty in school, and 30% of those really struggle when they learn to read. Reading not only affects them educationally, it's going to affect them vocationally as well. They're not going to be able to prepare for the particular jobs that they might want to have. So there's an overarching issue with reading disabilities in terms of vocation, social interactions. These children are much more likely to drop out of school before they finish high school, even though they may be very smart and highly intelligent. And once they're out of school, they're more likely to end up in the judicial system. The problems affect their mental health. Many of them have very low self-esteem because they haven't learned to read and they don't know why.
And it's not just that they're not being taught well or not working hard enough. They actually have problems. There are a number of different problems. So many of us think of dyslexia, but that's really only one of a number of problems.
Absolutely. And it's very important that we differentially diagnose these children because, as you mentioned, there are a number of different profiles. For example, there are children who have very broad-based language disorders at the spoken level and also at the written level. These kids had difficulty as they were growing up with vocabulary development, with sentence structure, with comprehending what was said to them. Now these children, for example, when they begin to read, may also have the written problems on top of the spoken language problems. These are the kids who we call language learning disabled. You mentioned dyslexia earlier. With dyslexic children, oftentimes their spoken language is very good, and we don't see any problem until they begin to read. And then they have difficulty recognizing words, they have difficulty with sound symbol correspondences, but their comprehension is always pretty good. But each profile requires a different kind of treatment.
Now, you're a speech-language pathologist. First, tell us exactly what that means and what role the speech-language pathologist plays in helping kids with reading issues.
In the past, we've worked primarily with listening and speaking, but reading and writing is just speech written down. One of our primary tasks is prevention. 95% of the reading disabilities that we see can be prevented or reduced, and these are reading disabilities due to environmental factors.
So ideas, what can we do for prevention?
Well, for prevention, there are a lot of things that we can do. The first thing is early identification, noticing that a child is at risk for a reading disability. And there are lots of signs that children show. Very young children are going to have difficulty learning language, and so we need to put them in a very rich language environment. We need to speak to them, and that means that we have to identify them and put them in programs that will help them to develop.
Now, you mentioned environmental early on. Now, was that, when you're talking about language-rich environment, is that different than environment meaning some of the surroundings, things in the soil, for example?
Yes, it's very different. When I talk about the environment, I'm talking about books, magazines, television. There are many children who don't have access to these kinds of materials because they may come from a home that's economically impoverished, or they may be second language learners, or they may be from an underrepresented group of individuals. These kids are at high risk for reading disabilities. But the good news is that these are the kinds of reading disabilities that we can prevent by altering that environment, getting them into school-based kinds of activities where they have books and they have print materials and they have people to talk with them.
Years ago, I did a story on a grown man who was later diagnosed as having dyslexia. Mm-hmm. And he recalled that when he was a child, he had problems reading, and then he would get punished, or he'd be in trouble because mm-hmm. he'd have problems reading, and it mm-hmm. became such a mm-hmm. cycle of guilt and taking responsibility for something that he really could not control and needed help for. Do you
Yes.
see that a lot of times? And people don't realize, well, it's dyslexia. It's not that this child is not trying.
Absolutely. And that's what the NIH researchers meant by the #1 health problem. It causes all sorts of anxiety, social issues, beginning to think that, well, maybe I really am dumb. You know, I just can't get this.
And there's different levels, are there not? I mean,
Oh,
you can
absolutely.
have a mild case, if you will call it, and so therefore it may take a different type of treatment and also may go unrecognized for a longer period of time.
That's absolutely true. And what our goal is today is to get these problems recognized as early as we can, because the earlier we identify them and start to treat them, the faster we're going to resolve them and the less time it's going to take. I wanted to respond to you about the adult who you met many years ago. We can work with adults. We're not just limited to working with children. Adults who haven't had good instruction have the same kinds of problems as children, but we just need to use different materials.
And we'll talk more about that when we come back.